Good afternoon, everyone. I'm Dr. Jeff Ritter. I just want to say that the last two presentations were outstanding. I'm thoroughly impressed. I was supposed to present yesterday. My field is healthcare marketing. I couldn't make it, travel issues, so thank you for being here. I promise, since I'm the last presentation, I will make it really short and sweet. But in any case, thank you all for coming and staying. My fields of interest include marketing, healthcare, management, consulting, and education. I try to blend them all as much as possible. And this particular research that I'm initially focusing on and developing as we speak is focusing on the healthcare space in the United States and how organizations market effectively with regard to how their healthcare organizations advance. And just as a brief background, healthcare in the United States is a fragmented market. There's not one single entity that oversees all of healthcare, although we have Medicare, Medicaid, the VA system. We have some governmental programs that cover millions of Americans. However, the system is made up of providers and payers, insurance companies, managed care companies, pharmaceutical companies, extraordinarily complex. A wonderful healthcare system, but complex with its challenges. So my focus has been on how do healthcare organizations effectively market? What should they be doing? What shouldn't they be doing? What are they engaged in? And I've looked at various elements of research, and a couple of things came up. Value in healthcare, along with quality and other initiatives, has become a critically important subject and an area of research and focus. I like to call it the 3 Ps: preferences, precision, and process. There's a significant increase in the use of analytics, and of course, based on the last couple of presentations, artificial intelligence, especially in the areas of marketing and healthcare, have changed dramatically. How healthcare providers engage in business development and marketing, expanding their businesses, has also changed. And the healthcare consumer, the sophisticated healthcare consumer, has changed the dynamic. They become very engaged, they research, they compare, there's word of mouth. There's a lot of challenges now where consumers are now asking questions, hard questions about outcomes, about data, about quality of life after procedures, so on and so forth. So the marketplace has changed dramatically, which leads to the component I just mentioned, enhancing impact, outcomes, critical drivers, what happens after the delivery of services, what happens from a clinical perspective, what happens from an administrative perspective. Those things matter, and they're becoming more and more important as we speak. Choice, as I mentioned earlier, consumers are much more engaged, are much more informed, and are challenging the status quo, asking the tough questions, looking at competitive initiatives, determining where they take their business based on procedure or services that they're engaged with, or their families and friends as well. The marketplace has changed dramatically. There's a much greater focus on rural areas throughout the United States where there's a significant lack of access to healthcare for a variety of reasons. In fact, the data shows many hospitals throughout the United States have closed over the last few decades in rural areas because of lack of funding and a variety of related issues. Hospital portfolio strategies are changing. Hospitals are now no longer waiting for patients to fill beds. They're engaging in ambulatory facilities, outpatient centers, and taking their brand and moving it into communities, and having the mothership representative of the overall healthcare quality component and sharing that in communities. It's happening throughout the New York marketplace, throughout the Northeast, throughout many parts of the United States. Physician online reviews becoming more and more important, much more engaging, just as we review hotels and restaurants and so on and so forth. Physicians are being reviewed, and hospitals are, as we speak, There's a lot more engagement with social media and online marketing. There's a greater emphasis on advertising high-tech procedures. On a personal note, I just had bilateral knee surgery 3 months ago. One of my knees was operated on by a robot. It's really impressive. It's really amazing, but it's not covered by insurance. So there's some out-of-pocket expenses. But a lot of the advertising from the provider side is coming from the high-tech usage, greater accuracy, greater outcomes, better performance. So interesting changes happening in the marketplace. Competition is fierce, and it's becoming even more so. The nonprofits versus the for-profit systems. Not a lot of distinctions between the two, except for for example, some of the ways they file their taxes and they report revenues. New research directions. I have a laundry list included here. We have healthcare producers. We have wearable devices. We have AI as a significant influencer. Healthcare providers, as I mentioned before, changing the dynamic in terms of how they engage. Ongoing engagement with healthcare consumers. As I mentioned before, the reviews and a much greater focus, for example, in what's called healthcare communities, which have been gaining momentum over the last decade or so. Here's, I think, the critical component. Healthcare organizations engaging in what's called strategic marketing, and not only looking at marketing strategies and objectives, but and I have a background in management consulting, but all the components of the mission, the vision, objectives, and values, and do they align with the marketing strategy? That's become a critical endeavor. The insurance and managed care sector, which essentially is the payer sector, they have changed the dynamic as well. How they market to consumers, how they market to providers, how they market to government entities. They have different strategies based on their various target markets. Providers becoming much more engaged in day-to-day operations and marketing and strategic planning activities. Tech companies realizing the importance and relevance and opportunity in the healthcare space. The Amazons, the Apples, Microsoft, all in and around healthcare engagement and organizations, and we'll probably see that continue to expand. And the healthcare consulting space, growing rapidly. Years ago it was the big 8 accounting firm, now I believe it's the big 4. They all have significant engagement with regard to the healthcare consulting community. Their accounting practices are just still a little bigger than their healthcare consulting practices, but they're gaining momentum. So there's a lot of activity. You've probably heard of revenue cycle management. It's a way for providers to collect additional revenues, millions of dollars sometimes that are out there in the marketplace that require follow-up and engagement. Trends, a much greater focus on an element of marketing called consumer behavior, the area that focuses more on the psychology and sociology of marketing and how it relates to healthcare. Social media in the healthcare space has changed dramatically. And of course, as I mentioned, the technology companies gaining momentum and really investing in the healthcare space. We're going to see tremendous changes, whether it's the delivery of mail-order prescription drugs or a whole host of other factors and areas of opportunity in the healthcare space. Notice I'm speaking quickly because I want to wrap up. I know you guys are ready to move on. So the environment, obviously we've got a presidential election coming up in November. There has not been a lot of talk about healthcare, but there quite frankly, there should be, because it's such a significant and important topic. And both parties have an obligation to discuss their positions with regard to healthcare, the Affordable Care Act, many issues related to healthcare. Economic factors, the cost of delivering healthcare, the changes in the marketplace, the reduction of the uninsured, which is a good thing, but many changes that have occurred in the marketplace, and of course the regulatory environment and the impact from a state and federal perspective. So, thank you. So some challenges. The current system, as it is today, is a very good and effective system. We can do better. We compare ourselves to other countries around the world. We have some areas of statistical data that show we're effective and on par. Other areas can improve. We need to make significant improvements. There are financial strengths based on our system and changes. There's cost sharing, for example, where employers, when they're hit with significant increases in the cost of delivering healthcare, they pass it along to the employees. And the employees have to pay a greater share out of their monthly, bi-weekly paycheck. Medicare and Medicaid, foundational programs that have been in existence for 60 years. The bedrock of providing care to those who can't afford it and to those who are retired and need assistance. We need to maintain and build the financial wherewithal to maintain these programs as we continue on as a country. We have an obligation to do that. As I mentioned, the fragmented system, it will probably always be a fragmented system. Healthcare is a very large business, but the reality is value and quality need to be the foundation. We need to find some middle ground where we can provide care to those who need it in an affordable way, but making sure that some individuals who are paying into the system are paying their fair share. So there's got to be a fair balance, an equitable balance. The aging of citizens in the United States is another issue that needs to be addressed. It goes back to Medicare, it goes back to other factors, but healthcare is a fundamental issue that impacts all of us. It needs to be brought to the forefront. That was it. These are my references. Short and sweet. Yes.
I'd like your views on something that happened in the UK some time ago. And the idea was to reduce, on a political sort of understanding, the amount of patients that were on the waiting list, for example. They decided to create something along the lines of a virtual hospital. Now, the virtual hospital was obviously in the cloud, but what it was constructed of was a hospital with beds, reference numbers, etc., that was supported by nurses, doctors, consultants, an online pharmacy delivery service, which actually then took the responsibility away from the individual going into a hospital. And the threshold for that patient would be of a certain mobility. How was that ever discussed in the US?
So I know we brought up COVID earlier, and during COVID, telemedicine and telehealth started expanding greatly. It's subsided for the most part since we've kind of moved past the COVID pandemic, but there's an issue in the US with regard to reimbursement.
Right.
The reality in this country is providers are paid based on illness, not wellness, and not the future engagement. So if there's no code to put down for reimbursement, there's going to be a challenge. But it's a brilliant idea, and again, I think a lot would have to do with, will the insurance pay for such services in the United States? And is there enough technology available for those who need it to get the training and knowledge to be able to use something like that?
Yeah, I think the direct link would be the aging population.
Which would be wonderful. They would just need the ongoing support and dedication tapping into those services.
Questions, please.
Yes, sir.
Yeah, my question is, in the last several years or so, I've never seen so much marketing, advertising for medicine, okay? I mean, what is the strategy there? I'm sure companies, okay? Ozempic and all this cheerfulness, and then in addition to that, they have
Let the buyer beware.
side effects. I mean, you take medicine and that has like a dozen side effects. How powerful is this message?
We see the pharmaceutical companies engaging in significant marketing activities.
Right.
We see the commercials in the
Yeah,
evening.
yeah, awesome.
We see, and they're wonderful. People are smiling and singing. I hear songs from when I was a kid. Now we're older and we have all these wonderful illnesses and diseases, and it's all happy. We have to be careful, but keep in mind, a lot of that marketing is geared toward the provider. The pressure is put on the provider because the patient is seeing the provider, and the patient says, "I saw that commercial.
Right.
I love that drug. Can you get it for me?" So the
Yes.
pressure then becomes, is the provider willing to put that into an engagement with the consumer? Yes, sir.
Also follow up to that question, just 4 quick terms: traditional medicine, alternative, naturopathic, preventative. Can you speak on how that would fit in, on how there are cultural differences, whether that's accepted or not?
You know, again, our system is based on illness and disease. If you're not sick, the challenge of a provider getting paid is difficult. However, there are plans and programs where members can set aside money in health service accounts and use some of those dollars for massage, for acupuncture. Those things are wonderful. We need to start focusing on a wellness and preventative based system across the board. We keep people healthy, we keep them out of the hospital, we keep them off the meds. So if I had the answer to that, I'd be in an island right now.
Thank you so much, Dave.